I don't think I need this. I'll go through the motions of looking like I need it. My voice doesn't carry. Good morning. Thank you all so much for being here with myself and Dr. Alexis Granite. I'm sure you know Alexis. If you don't, she is one of the best, if not the best, aesthetic doctor and dermatologist in the UK and beyond, and someone I've known for a long time whose face I often put my hands into. And firstly, it's actually sad. I'm sad to see this many people in the room because as someone that's experienced hair loss and hair shedding, I know how traumatic it is, how upsetting it is, how dehumanising it is, and how scary it is. And if you're in this room, it's not usually because you're just checking out this space, right? It's because you're either having an issue yourself or you know someone that is. And for that, I can very much sympathise and empathise with. About 13 years ago, come in, hi. No, you look like you've got far too much hair. See, this is what I said, it's either for you or for someone that you know. So about 13 years ago, my hair started filling up everything apart from my head. So it would fill up my hairbrush, it would fill up my pillow, it would fill up my floor, it would fill up every sort of sink plug outlet in the 2 bathrooms that we have. And at first I thought it was very natural postpartum hair loss because I'd had my second daughter, but 2 years later it was still happening. And I would touch my hair like this and it would just come out like this. And the texture of it changed as well. It went really coily, really dry. And it seems like such a superficial thing. Oh, it's just hair, you can still live. But actually, it's not superficial. It is very much part of your identity and very much part of it brings you such confidence and joy, and you only realise that when you don't have any or you are threatened to lose it. So for 13 years, I have been through everything, every treatment, I've paid, I've thrown money at it, I've tried to find a solution, I've done everything you could possibly imagine. And what I want to do is share what works, what you need to focus on if you're having this problem. Let's part what doesn't work, let's just focus on what does, so that the short time that we have together, you can find some really useful and actionable advice that you can put into practice. So we haven't got long, so I want to sort of fire through it just so there's some question time at the end of it, if that's okay as well. So I'm just going to ask Alexis first off the bat, so she actually has a chance to talk. What's the first place to start? Is it understanding what type of hair loss you have?
Exactly. So basically, there are actually lots of different types of hair loss. We sort of separate hair loss into 2 categories, so non-scarring hair loss and scarring hair loss. I'll leave scarring hair loss completely out of the conversation if that's okay for today. It's a lot less common, but generally that's a type of hair loss that has to do with disease within the scalp skin. And it's, like I said, less common than non-scarring hair loss. So with non-scarring hair loss, you don't generally see anything in the scalp. If we looked at your scalp, it would look completely healthy and normal. But those types of people who struggle with hair loss, I myself have also, will start to see noticeable increase in hair shedding, and then ultimately that can lead to, the appearance of less hair. So essentially, when you talk about non-scarring hair loss, there are 2 main types. The sort of one of the most common types is something called telogen effluvium, and if any of you have ever had children in the room, you may have experienced this. So ultimately what happens is we were discussing kind of going quickly through the biology of it just to get to the treatments, but ultimately your hair grows through many different cycles. And the final stage within that cycle is what's called telogen, which is essentially your shedding phase. And so after you have an illness, after a pregnancy, after a big sort of hormonal surge or shift in hormones, a lot of the hair can then transition to that telogen phase all at once, and then it starts to shed. In a normal healthy scalp, you have all of your hairs are sort of staggered between the phases. So most hairs are growing, some are resting, and then some are shedding. And so you get this kind of constant replenishment. And interestingly, all of your hair has different cycle lengths. So that explains why your eyelashes don't grow to your knees. They're not programmed to grow in the same way that scalp hair is. So telogen effluvium is actually a very common type of hair loss. The good news is that by and large, it does resolve on its own. And one of the frustrating things with hair loss is that hair loss can actually occur many months after that inciting event. So for example, when you're pregnant, your hair can look great full, healthy, that comes from the estrogen that's throughout pregnancy. And then you have the baby, and then all of a sudden, 3 to 6 months later, you're like, what is happening? All of my hair is falling out. And that's because it takes, with hair, there's always kind of a delay in that event, and then the sort of subsequent symptoms that you see in the scalp.
Which is actually a bit pleasing. So it's not like you immediately have a baby and then your hair falls out straight away, because that would be even more.
Yes, you have a lot going on. You don't want to worry about your hair. But in very rare cases, telogen effluvium can be more chronic, and those are the types of cases that often have to do with something that's going on within the body. So a vitamin deficiency, again, sort of an illness. But the good news is that those are very treatable types of hair loss. The more complex type of hair loss in women, and I'm mainly focusing on women, sorry, is what we call androgenetic alopecia. So this is female pattern hair loss. So this essentially mirrors what happens in men. As we know, a vast majority of men will lose some of their hair as they age. And in actuality, that happens to a very large percentage of women too. So up to 50% of women by the age of 70 will experience some type of hair loss. Yeah. And it isn't something that gets as much attention as male pattern hair loss. And so with androgenetic alopecia, this has to do with the way that hormones work on your hair follicles. So we talk a lot about hormones and hair loss, but oftentimes when we test your hormones internally, so if we were to do a blood test, your hormones look completely fine. It's the interaction with the hair follicle within the scalp that's causing the issue. A lot of this, unfortunately, is genetic. So a lot of it is beyond your control. And when we talk about androgenetic hair loss in women, it presents differently than hair loss in men. So hair loss in men will often start with some receding. They might have the bald spot, the top of the scalp, and that's a very classic pattern. In women, it often starts to present as a widening of your part. So you start out with a very thin part, and then ultimately over time that will widen. And then later on, you may get some of that receding, and that sort of what we call in the triangles of the scalp will start to move back a bit.
Yeah. And there's also a slightly different, so this is obviously very hormone-induced, lifestyle-induced, nutrition-induced, but there is also physical hair loss that you can experience through over-processing, dyeing your hair too much, going out in the sun, not protecting it. And that's a kind of hair loss that is very easy to fix, because it is not anything that's happening internally, it's all from external factors. So if your hair is over-processed, it will present itself as breakage, it will snap, it will become very dry and brittle, and the only way to combat that is to stop colouring it, just to have a complete resting phase, to cut it. You just have to cut it so it looks healthier to begin with, and you have to use lots of conditioning treatments and this kind of stuff, right? So that's the hair loss that is very easy to combat. So then there are these other two, which it's taken me a long time to realise which were the ones that I had. So if you think about, once you've decided what type of hair loss you have, if you can't decide, you should see someone like Alexis, dermatologist, because they can look at your scalp under a microscope and they can tell you whether it's pattern baldness or whether it's what I had, which was telogen effluvium. So everyone loses, on average, 80 to 100 hairs every day. That's completely and utterly normal. Your hair doesn't stay in your head forever. If it did, you wouldn't be able to go anywhere because you would be covered in hair. Yes. I've forgotten what I was saying, yeah. But the hair type that I had, telogen effluvium, which was means that my hair would grow but wouldn't stay in my head. So it would just shed and shed and shed, and then eventually your ponytail gets like this big, and you're like, oh my God, what's happening? So once you've established in your mind what type you have, if you can do that, if you can't go and see a dermatologist, they will be able to tell you more or less immediately by having a look at your follicles.
Yeah, absolutely. And I think one thing, I think it's great to also highlight that losing, up to 100, even up to 150 hairs a day is normal. So you have to shed hair, obviously, and grow new hair. But I think one of the important things when you're really experiencing quite rapid hair loss or very noticeable hair loss is to have sort of baseline blood work done. And part of that is because there are things that you can address very easily with hair loss, 3 of which are sort of hormone imbalances, particularly in underactive thyroid, iron deficiency, which is a huge cause of telogen effluvium, and also vitamin D deficiency. And the vast majority of people in the UK are somewhat vitamin D deficient. That being said, most people with vitamin D deficiency do not develop severe hair loss, but there are very addressable, treatable things that you can quickly kind of reverse, and that will really help hair loss. Unfortunately, the vast majority of cases of hair loss are a bit more complex. So you don't always have one thing that you can point to and say, okay, I'm going to correct my, vitamin, D deficiency, and my hair is going to miraculously, return to its state that it was. And oftentimes, as women get older, you may have a bit of a combination. You may be incredibly stressed, iron deficient, and have a little bit of pattern hair loss.
And pre-perimenopausal, or menopausal, or postmenopausal.
Yes. So there may be multiple things going on that can be addressed. But that being said, there are very easily fixable issues that can contribute to hair loss.
And that's what we're going to touch on, all of them. I think also as you get older, your hair does become thinner, finer. That's just a fact of life. What do you call them? Pores? It's not pores.
Your follicles.
Yeah, your follicles, that's it. They shrink. So that's actually a natural order of things. That's why you don't often see very, older people with like huge rounds of hair, because it's just the natural cycle of how things work. So if we are starting from a point of bloods is the thing that changed my life. And I only had my bloods done 8 years into my hair loss situation, and probably paid my mortgage off in the amount of time, things that I'd had done before then. But if you can afford to get it done, then it is the game changer, because unless you know what's going on inside your body, it's mainly guesswork. And sometimes guesswork works, and we'll give you some educated guesswork that you can try that may work for you. But until you fully understand, or certainly in my case, I fully understood, I didn't realise that I was perimenopausal when I was in my late 30s. It was early, and no doctor is going to suggest that to a woman, that you may be having hormone issues at 38. Your GP also, just so that you know, may run bloods for you if you are lucky enough to get a sympathetic GP. However, their markers are very different. They are looking for your overall health and well-being, not how your hormone levels or how your vitamin D or iron levels need to be for healthy hair loss. So when I first had my bloods done, my GP said to me, well, you're totally fine. Yeah. Because I was alive, I was healthy, I was well, I was all of those things. I took those bloods to a dermatologist, and she was like, oh no, your iron is far too low for healthy hair loss, and your body's not storing iron either. And she put me on a very strong iron tablet and vitamin C, so my body stores the iron, and then my hair started to replenish. Do you see, like, your GP is not trained to understand everything about everything. And I think they usually call it a derm holiday, don't they, GPs? When GPs are learning how to be a GP and learning everything, when it comes to dermatology, they call it like a derm holiday, because they get 2 weeks off because they don't want to do it. It's hard.
Yes, it is. And I think that is a really good point. So iron is a perfect example. So part of the way we test iron in the blood is through a protein that complexes with iron called ferritin. And oftentimes your ferritin level will look normal within a normal range. But actually for optimal hair growth, it should be around 70, which is well above the sort of lower range of normal. So it is important, I think, do what you can at home, and we can certainly talk about treatment options that you can do kind of on your own. But if you really are struggling with hair loss, ideally you can see someone who specializes in this, because there are complexities and nuances to the diagnosis and also to the treatments.
For sure. So, okay, let's say if we were starting from the beginning, from at home, what is the very first thing maybe you suggest?
Yeah, I think I like to sort of look at treatments as a ladder, and I do this in aesthetics as well. And I think there's sort of 3 ways you can approach healthy hair. One is to make sure that the hair that you have is as healthy as possible. So nourishing the hair, making sure your scalp is healthy, and those are all kind of things that you can do at home. Mm-hmm. So we talked about sort of scalp massage, scalp oils. I think the tricky bit with hair growth and treatments for hair growth is there is a lot of
noise.
Yes.
And bullshit.
Yes.
And marketing claims. There are, and you have to be, so easy to get drawn into all of this stuff. Some person on Instagram with this fabulous hair telling you that she's used some oil and her life's changed and whatnot. Nonsense.
Yeah. It is true. I mean, and the thing is that there are definitely oils and serums and supplements that can help keep your hair as healthy as possible. Are they likely an over-the-counter treatment like that to regrow hair? You know, it's unlikely. So I think some of my favorites, you know, we talk a lot about rosemary oil, and rosemary oil is a lovely oil and probably really does have benefits for the follicles that you have that are already healthy, for stimulating. So when we think about why it's working in the scalp, one is that it's keeping the scalp healthy. It's helping the hair kind of strengthen. Like you said, we don't want brittle hair. We don't want hair breakage.
That makes it worse. When
Yeah.
your hair's falling out and the quality of it goes down,
Hi, just with regards to the oils,
Yeah.
How would you recommend using them? So do you keep them on overnight and
Yes.
wash them off in the morning?
Yes, ideally, yeah.
Or just keep them on for an hour or two?
No, normally I would say, so with serum, so I'd say two of my sort of favorite over-the-counter ones. One is a brand called Vegamore, which is more a botanical oil-based leave-in serum. So that's very easy to use because you can easily incorporate it into your hair. It doesn't become greasy. You can put it on, I can't remember now if it's once or twice a day, but you can certainly use it in the morning. You know, after you've washed your hair, it's damp, you put it on and then you dry your hair or style it. Oils I find are a bit trickier because obviously it's hard to style your hair with an oil. So the best time to put those on is at night and then wash it off in the morning. But you do want to have long contact with the oil, not just like a 1 hour treatment. Things like hair masks and shampoos and all that are lovely and absolutely can help maintain the health of your hair, but they are unlikely to regrow new hair. And then supplement-wise, you know, there is a lot of noise out there, is a polite word, for supplements in terms of hair growth. And what you really want to look at is are there any clinical studies that back up the claims that supplement is making? And truthfully, one of the main ones that does have some good clinicals behind it is a brand called Nutrafol, which actually comes from the US. You can get it here through Amazon. There's a couple of...
how are we spelling that?
Nutrafol. They have a few different versions. Some of the versions involve collagen, so marine-derived collagen. So there is some benefit potentially to also supplementing with collagen. The issue with collagen, and the reason why I don't take it is because it's not vegetarian, so I'm a vegetarian.
It's a bit of a jury's out situation,
Yes,
isn't it?
but there is some loose evidence that collagen could potentially be helpful for hair growth. It also just has amazing skin benefits too for hydration. So it's, again, something to certainly think about and try. It does have other benefits. Are you going to have a giant fluffy head of hair from that? Probably not.
I'm just curious, I've heard a lot about iodine for hair growth.
Yeah, no, not so much.
Yeah, it probably stains all of your bathroom
Yeah,
and your
it
sheets
does.
and all of that kind of stuff. What I would say is that don't avoid brushing your hair.
Yeah.
And I did. I avoided brushing my hair because every time I brushed it, it was very stressful, and lots would come out, and I thought I was pulling out more hair, and actually I wasn't. I was just taking away what would come out anyway. And your hair needs to be brushed because you get the scalp stimulation. It also pushes the natural oils down your hair, which helps to keep it healthy. So don't avoid brushing. I use a brush called Manta, M-A-N-T-A, which it's 30 quid, and I was like, I'm not paying 30 quid for a hairbrush. And then I had this hairbrush, and it's not like a tangle teaser still grabs through your hair. I feel like a tangle teaser exists for people that have got great hair to get knots out and to do it like my kids, my girls. But with the Manta, what it does is it doesn't grip to the hair, it just gently slides down, so it will get out all of the knots and tangles, but it will also leave your hair shiny. It won't compromise the quality of your hair. So don't be worried about brushing it, and don't be worried about washing it. One thing I used to do was wash my hair once a week, again for the same reasons as brushing. I thought if I washed it less, it would fall out less. Not true. You need that stimulation of the scalp, like Alexis said.
Yeah, and that's a really good point. So kind of above the ladder of sort of topical treatments that you can buy over the counter just to help strengthen the hair and keep the scalp healthy, things like scalp massage, scalp brushes, anything to try and produce and stimulate blood flow to the scalp can be very helpful in trying to regrow hair and also preserve the hair that you have. And so you can do that at home through brushes and devices, but also...
Or for your fingers.
Yes,
just give it
do
a
your
good...
fingers.
You know when you go to this, if you go and get your hair done at a salon and you get someone that washes your hair and they get their fingers right in and it feels amazing.
Oh yeah, amazing. And it helps reduce stress, and stress obviously plays a big role in hair loss as well.
Yeah.
So certainly those can be quite helpful, again, with a modest improvement. So definitely going to help, but it has to be sort of part of a larger treatment plan in terms of hair loss and regrowing hair.
And what about food?
So diet is always a tricky one when it comes to hair and skin. I think the main things with food is supporting a healthy diet, overall with overall health benefits, and making sure you're not deficient in any vitamins. So for example, if you do follow a specific diet like vegetarianism, making sure you're not and vegans, making sure you're not deficient in things like folate and vitamin B12. But diet as well, unless there is a deficiency, is unlikely in a modern industrialized society to be causing massive amounts of hair loss. Yes, very severe vitamin deficiencies can definitely contribute to hair loss. But if you're eating a very typical kind of Western diet, it's unlikely.
Yeah, perfect, okay. One of the things one supplement I do take actually that I've tried all of those expensive hair loss ones, like the ones that cost £50 from Holland and Barrett that have got, the Viviscals and all of that. I've tried all of those. They're really expensive. You run out of them really quickly. I didn't really notice much difference. But a supplement that I have noticed a difference with is omega-3 oils. And that has been for the quality of my hair.
Yeah.
So and my skin, actually, I've noticed benefits.
Yeah, that's a very good one as well. So that's also one where that's going to play into that strengthening of the hair. It's going to help to kind of boost circulation within the follicles. And omega-3 also has great benefits for hair, skin hydration as well.
Like my niece is having, she's only 23, but she's having a real issue with her left eye and it's starting to lose vision. And before she can have her operation, her optical surgeon has told her to take lots of omega-3 oils so she can lubricate that area.
Yeah.
So that just tells you that it's going to do something. And I noticed when I stopped taking it. Okay.
I was going to say, I think so. Just in summary, you have your sort of Nutrafol, which I do think is, of the supplements, is probably the best one out there. Consider things like collagen and omega-3s. And I think that's not only for hair benefit, but also for skin benefits. But in those cases, we're talking about mainly supporting your scalp health and supporting the skin that you already, the hair that you already have, less likely to actually regrow a lot of new hair.
Yeah, so don't worry too much about this shampoo or that shampoo or whatever, because they're not really going to stimulate hair growth. They're not going to stimulate hair growth. I'll just say that off the bat, they're just not. But unless you are making your hair damage from using over-chemically processing and all that kind of stuff we talked about before. Okay, let's go one step up. Things like these hats with the LED lights and that kind. Does LED help with?
It does, yes. So actually, I just did an event with Current Body, who's an LED manufacturer of multiple different types of masks, and they do have a helmet that uses red light. There's a couple different types of, you can use LED, which is essentially visible light that you see in all the different colors, so red, blue, green. Red in particular has been shown in clinical studies to improve hair growth and reduce hair shedding, as well as what we call low-level light therapy. So the two different types of hair treatments you can buy at home, they tend to be helmets or baseball hats with lights in them, utilizing those two different technologies. And
either way, you look bloody ridiculous, but it is like it's non-invasive, isn't it?
Exactly. So no side effects, and I actually do think those can be helpful. So again, relying on that solely as your option for reducing hair shedding and hair growth is probably not the best idea, but as part of sort of a comprehensive treatment, absolutely. The one thing I would say with LED or a low-level light therapy is just that consistency is key. Yeah. So it is something you pretty much have to do every day.
Leaving it in your cupboard and not charging it is not going to do anything. Just so you know. And what about microneedling?
Yes. So
you knew what I meant.
Yeah, absolutely. So microneedling is generally done more effectively in clinic, and that's where we take small needles to try and again stimulate the scalp. And the whole concept around that is to basically stimulate blood flow to the hair follicles. Mm-hmm. And yes, there is science behind that as well. It is something that, again, I know I'm going to sound like a broken record, but should be done as part of sort of a treatment plan. So again, I wouldn't rely on microneedling solely. Mm-hmm. There's also mesotherapy, which is sort of similar concept where we take small needles. It sounds horrible, but it's really not that painful. And you are able to deliver a cocktail of ingredients into the scalp skin as well. So there's a lot of hair clinics that actually use all kinds of cocktails, one of which often includes biotin, which we haven't discussed, but I know
No.
biotin is bandied about quite often as a great sort of treatment for hair loss. And
Which only works if you are deficient in it.
biotin.
That's the thing, like in all of these places they go, biotin, biotin, biotin. Everyone thinks biotin is the number one way of treating hair. It is if you are biotin deficient. And actually a very small number of people in the population are biotin deficient. So that's why blood work that we talked about at the beginning is important, because if you identify that, then take the supplement. Otherwise you're just flushing your money down the bin.
Absolutely. One thing that can be helpful, and that is a relatively newer treatment, is, so we can talk a little bit about, there are prescription medications that you can take for hair loss, including things like HRT for women, and then I don't know if you all have heard of minoxidil and finasteride. So these were historically treatments that were given to men for male pattern hair loss, and there is a role now, for females to take those types of medications. The issue is that oftentimes there's a limit to kind of age range that's because they can have sort of other side effects, so they're often given for postmenopausal women. But there's some interesting data now showing that you can actually topically, with mesotherapy, deliver those medications into the scalp skin and avoid a lot of the side effects that come with taking those medications orally, and they do actually help improve kind of hair growth.
How would you prescribe topical minoxidil? What's the best way to use it?
Yeah, so
for women to use?
absolutely. So topical minoxidil under the brand name is Regain. It's Rogaine in the US. And actually it's available without prescription at a 5%. Some sort of hair clinics will also compound a slightly stronger version, 10% minoxidil. But you
Kingsley do that.
Yeah, but you can get it over the counter, and I'd say on the treatment ladder, that's probably like step 3. So you start with your kind of supplements and your hair products that just help strengthen the hair. Then you might move to your tools at home, things like brushes, combs, your fingers, and then a helmet. And then Regain is sort of step 3 on the ladder. It can be very effective. It's a bit of a faff to use is the only thing, because it's expensive. Yep. And the one issue with it is it often does cause hair growth elsewhere. So not like a big bushy beard, but you will, for a lot of women, notice that you're a bit furrier than you were before.
Lovely.
Despite the fact that you're not using it on those areas. So you may be applying it here and then you're feeling that, elsewhere. But overall, it can be quite effective. Again, it's one of those treatments that takes sort of 3 to 6 months to really see an improvement. So it is one that you have to be consistent with. And the other thing I would just say around those is that they are something then you have to continue to maintain the benefit. So people often worry, if I use it and then stop it, is all of my hair going to fall out? No, but you will just go back to kind of your baseline that you would have naturally been at. So it is a bit of a commitment in that sense, because once you're doing it, you're sort of doing it ongoing. But I do have a lot of patients that have had a lot of success with Regain.
How often do you need to use it? Is it every
It's
day
once to
or-
twice a day. Yeah. Yeah.
And just so that you know, there's this thing called a pink tax, which is like a marketing thing, which is that when certain things are marketed to women, they're more expensive. So you'll find, like Rogaine for men is the same as Rogaine for women. However, one's called for men and one's called for women. And the men's one is cheaper than the women's one. It looks like it isn't because they're different sizes and there's a different dose, but they are exactly the same. So don't be drawn into thinking you need to buy the female one, because you do not. The male one is exactly the same. We've done a lot of research in it. I hate the company, and I just don't care about saying anything awful to them, because they're basically, 1 in 3 women now are experiencing hair loss in one stage of life or another. Yes.
What about grey hair? Can we reverse it by new technology?
Grey hair?
Yeah.
No. It's a pigment death.
New technology, not possible. Amino acid, something.
Yeah, there are some new ones coming out, sort of new serums that sort of slow hair gray hair, and I do actually think eventually there will be a treatment for that, but as of kind of modern medicine yet, no.
Yeah, still on the die, I'm afraid. I just wanted to quickly touch on HRT. Now, HRT, everyone thinks of HRT as that's when you get a menopause, and that's an older lady situation. Perimenopause is often when women start to see the first signs of hair shedding and hair loss, because your body is losing progesterone and estrogen, and they are vital for your hair growth. And also, if you're on the pill as well, by the way, that is a form of HRT. You are putting hormones into your body to stop your body getting pregnant. So you may notice when you're on a pill, that your hair is better than it was without it. And even if you've got the hormone implant, it's the same thing. So the minute that you stop taking that pill, you may notice hair loss and hair shedding, and it's because you have been boosting it with hormones. Now, if my hair started shedding at the beginning of my perimenopause, I didn't know that was when I was 38, or 36, just after I had my second daughter. If I would have put some progesterone, just a little bit of progesterone back into my body, it would have stopped that from happening. So don't think menopause is happening to some old lady over here, or you've read that. I mean, I am nearly 50, I don't know what I'm talking about, but if you are thinking that menopause is somewhere over there, that may be true, it may not be true, but perimenopause comes 8 years before that, or can be up to 8 years before that. And microdosing yourself, knowing that's happening in your body, you then can start introducing small amounts of hormones. Is that right?
Yeah, absolutely. And like I said, there is a big genetic component to female pattern hair loss too. So, you know, it's not necessarily just going to start at menopause. It can certainly start years before that. And I think that's kind of the last rung on the ladder in terms of, you know, oral treatments. So things like HRT, oral contraceptives. There's also a medication called spironolactone. I don't know if you've heard of, we use it a lot for acne, but it can be quite helpful in treating female pattern hair loss because it blocks some of the effects of male hormones on the scalp.
How are you spelling that?
Spirono.
Sorry, I'm like spelling bee, isn't it? Sorry.
I know. Spironolactone.
Thank you.
Spironolactone. And then obviously we get into the treatments such as oral minoxidil, which is the oral version of Regain, as well as oral finasteride, which is what oftentimes is prescribed for men for hair loss, and can be helpful for women as well. So that's kind of the final stage, but not one to be, you know, I think it's...
Don't jump straight there.
Yes, don't jump straight there, but equally, there are a lot of options available, so it's not something that you necessarily need to suffer with because just as you said, you know, I see so many female patients with hair loss and it really is quite, you know, debilitating and really affects confidence.
Yeah, it does. It makes you very sad. Yes. And if you've got any questions, ask and we can try and address them.
Yeah, so full disclosure, I'm a plastic surgeon with a full-time practice in hair transplant surgery. So I'm like number 10 on the scale.
Is that also why you've got great hair?
No.
Yeah.
It is confidence building then when you go and see a hair plastic, if they've got
So it's great discussion and great for everybody here who's got early hair loss. Two things I just want to say, and one is I think generally, in my opinion, if you go and see your NHS GP or NHS dermatologist, you're wasting your time. I would also say, and no disrespect to dermatologists, hair is a very small part of dermatology training in the UK. So if you're going to see a dermatologist, you have to really carefully pick one that says on their website, I specialize in hair.
Yeah.
There is a middle person you can see, which is a trichologist in this country. And some of them are fantastic, and some are charlatans. So again, they will spend an hour and a half with you and not charge you that much, whereas a dermatologist is generally going to charge you a lot. So there's kind of a middle person to go to. And just one thing that I think maybe the audience would be interested in, which you haven't mentioned, is polycystic ovarian syndrome in young women. So maybe a few words on PCOS.
Yeah, that's a very good point. So I think that is why it's so important to, if you are experiencing hair loss, to do the blood work. And one of the things that is quite common in women is something called polycystic ovarian syndrome, which is actually it's oftentimes diagnosed clinically, so it's sort of a constellation of symptoms. So you may have very irregular periods, hormonal acne, and then oftentimes that can be followed with hair loss and hair shedding, particularly in younger women. And that's very treatable with hormone, with things like oral contraceptives. Oftentimes spironolactone is used. We sometimes use another medication called metformin. So it is very controllable and, again, one that might present at an earlier age in terms of hair shedding and hair loss. And then I think very fair, probably the top rung of the ladder is hair transplantation, which oftentimes we think of as a male treatment, but certainly it is used for women as well. Maybe you want to just give a quick, synopsis.
No, I don't want to steal the limelight. I will say though that a lot of women are born with temporal recessions genetically. That's just their hairline, which they don't like. It's viewed as a more masculine type of hairline, whereas a feminine hairline is rounded. That's a really good indication for hair transplant surgery, just to create more feminine hairline, as long as there are no underlying hormonal reasons for it. And then as you're going through menopause, for reasons we don't fully understand, the temples do tend to recede, to thin out, get shorter, fuzzier hair, and again, that's a great indication for hair transplant surgery. Generally, female patients with hair loss, they're completely different from male patients seeking hair transplant surgery. I generally have them see a hair specialist dermatologist first. Very, very, very complex, episodic, peaks and troughs in hair loss. So I don't transplant that many women for generalized, what I would call female hair loss, pattern hair loss, not androgenetic alopecia. But in some patients who have advanced female hair loss, yes, they can have a hair transplant. It is complex, and it is way at the top of the rung.
Yeah, I think
it is also a very emotional issue for men as well.
Yeah, absolutely.
My husband had a hair transplant, and it's a it was such an emotional issue.
There are, I don't know if any of you watched the BBC News yesterday.
There's a lot of bad news going around at the moment.
There was a feature on finasteride in men, which is a very, very good drug. But again, in men, I don't do any bloods on men who are having a transplant, whereas I won't even see a lady with hair loss unless they've really been thoroughly investigated. And there are you've mentioned so many things that do cause hair loss, but stress, lifestyle, and a trichologist will spend that time. A good trichologist will spend an hour, 2 hours, digging into your whole lifestyle, and sometimes picking up stuff that even a really highly qualified dermatologist who has a limited time to see you and is going to charge you a lot might not pick up on.
Oh no, Alexis is free.
I can't imagine how much half an hour of her time costs.
It's worth it. Does anyone else have any more questions?
Yes. Is there a specific set of bloods then that we should be? I know, oftentimes I've had a blood test that was very basic for a specific health issue, but what are the kind of hair health specifically, are the specific bloods we should be requesting?
Yeah, I mean, it goes a little bit with what we're saying in sort of taking a history and are there other symptoms, and so because obviously there's so many different bloods you can do, but I would say sort of basic, the main sort of vitamins that we want to look at, certainly iron, certainly thyroid, and then for most women there'll be a hormonal panel which is quite sort of standard, so things like testosterone, free testosterone, your estradiol levels, there's things called FH, LH, but unfortunately it's a bit, women are just complicated, clearly more complicated than men, and so a lot of those bloods do have to do with your age and where you are in your cycle, so you do kind of have to go to someone who knows what they're doing and how to interpret them, because we could just draw your bloods and say, oh, well, this is not looking normal, but actually it totally depends on where you are in your cycle and if you actually are still menstruating. So, but yeah, there is a sort of, you do want to get those kind of basic vitamins, that sort of underlying health, things that are easy to treat. So for example, the vitamin D deficiencies, the iron and the thyroid, and then hormone levels.
Yeah, and actually that's when a trichologist becomes super helpful, because I went to see a trichologist and they know exactly the type of what to look for specifically for hair. So that's when, and I went to see Philip Kingsley and they were excellent.
If you're checking FSH and LH for hair, where in the cycle should you have the blood test?
Generally, they'll say mid-cycle for those types of testing, but it again depends a little bit on where you are in terms of age. So, but I would say generally mid-cycle.
And is it estrogen deficiency or the?
It can be either. So, basically the balance of hormones as we age is that for women, as they get closer to menopause and then through menopause, is that your estrogen will massively decrease, which can cause a lot of the issues that we see. So thinning of the hair on the scalp and then overgrowth of hair in places where you don't want hair. And so that...
It's such a gift.
So yes, it is that imbalance. And so, for example, in polycystic ovarian syndrome, we actually see that the female androgens have gone up in relation to estrogen. And in postmenopause, it's the estrogen that's coming down in compared to the androgens. So I can't remember what the exact question was. You were saying, yes, but the balance. But it is generally the estrogen, yes. And that's part of the reason why when you're pregnant, for example, that estrogen is rising and your hair looks amazing.
It's one of the reasons why, I tend to not call it androgenetic alopecia, because it is so complicated.
Yes. Yeah.
And why you really need to see somebody, if it is a hormonal thing, who really understands the nuances. And there is a suggestion even that in perimenopause, it's not an excess of testosterone, it might actually be a deficiency of testosterone.
Yeah.
And some women, if they have, again, their testosterone levels may look normal on the blood test, but if you've seen somebody with a really super specialist interest, just a small dose of testosterone may actually help you.
Yeah, and I think it's really interesting as well with the hormone levels, because you have to be careful. So I know we keep yammering on about to get your bloods tested, but a lot of times it's actually what is going on within the scalp that's causing an issue. So male pattern hair loss is a perfect example. It is related to testosterone and the conversion of testosterone to a even sort of stronger testosterone, but it's within the scalp. So most of the time, if you run around, it's not like men with baldness are that much, they have super testosterone levels. Do you know what I mean? So it's a lot of it is an interplay of what's happening in the scalp itself, and we see that quite a lot with acne as well. So we always talk about hormonal acne, but if I went around and tested lots of women who had hormonal acne, their hormone levels in their blood would be completely normal. It's the interplay of the hormones within the skin and within the scalp.
Let me just ask this lady at the back and then I'll come back. Yeah.
I just want to ask your opinion on, like, higher up on the ladder, injectable treatment. So
Like PRP.
Like PRP, and more recently, and there's a lot of talk about polynucleotides, exosomes. There's even something I've read about scalp Botox, which I have no idea whether there's. But what's your opinion on those?
Yeah, PRP definitely does have clinical studies behind it. So I do think that there is room for PRP, particularly. So PRP is basically what we call plasma therapy. So it's where we draw your blood, we spin it in a centrifuge, we take out the plasma.
It always makes me feel really sick. It's the spinning.
There's some spinning, yes, in a centrifuge. It's not like we hold it and we spin around, but we put it into a box that spins. And I actually anecdotally have seen improvements in hair shedding. I actually think particularly around telogen effluvium, so that sort of stress or episodic hair loss. But there are some clinical trials that show that it is helpful in what we call female pattern hair loss or androgenetic alopecia. And then in terms of so hair Botox has a little more to do with how the hair looks and feels rather than actual hair growth. There is some interest in that. But I think it sounds absolutely bloody benefit is probably minimal.
I'm not a doctor, so
and then polynucleotides I actually am quite interested in, and I think that could be something that's interesting. So polynucleotides, if you haven't heard of them yet, or everyone likes to talk about salmon sperm, but essentially polynucleotides are actually a component in your DNA. They're in our DNA as well, and they're also in salmon DNA. I have absolutely no idea how they figured out that this is useful for skin. No, they don't have a lot of hair, but they've isolated polynucleotides from salmon, and then we use that as mainly for skin boosting, so similar to Profilo and some of the others. It is actually quite good as sort of a collagen booster, and so there is evidence, there is some sort of anecdotal evidence that might be helpful for hair growth too. So I think that is definitely an area of focus.
But it's more of a just wait and see.
Yeah.
Whereas you're better off, I think, with your advice is to do the things that that have some clinicals behind them.
Yeah.
And have some testing and have been around for a bit long. And just maybe hold off on the others until there's a bit more research and understanding.
Yeah.
Science is ever evolving, isn't it?
Yes, yeah. And I think the treatments will get, I don't know if you agree, but better and better and better. But yeah, we're sort of at a precipice, I think, of other options besides things like PRP and the oral, prescription medications.
Also, there's been such a dramatic change and positive change in things like hair pieces and little clip-on things. Because the front of my hair, if you can see here, is all growing back since I've been on HRT, and it's all sort of growing around here. But it's taking ages. Yeah. So it's fine at the back, but at the front it just wasn't growing. So my son, who's now 3, has never seen my hair down before. And so I went to see this guy in Covent Garden, who's amazing, called Hadley. And he just I've got 4 on each side, and they're just little wefts. And they're really natural and really fine. And I just had those put in at the front. And they just have made such a difference to how I feel about myself. And so if you can't, if you're not getting anywhere, there is a medium ground of actually just sort of faking it till you're making it kind of thing. But again, or generally, the more sort of money you spend, the better it is. If you're going to buy, Nadine Baggett, have a look, she's doing this. I don't even know what she thinks she invented it, but it's some hair halo that you can put around your hair and it just gives you another layer of hair. Great. And that's an instant confidence booster. So in the meantime, don't be scared to look at things like that, like little hair pieces. And one thing I used a lot of as well was hair accessories. So I'd be wearing ridiculous bows and scrunchies that just made you feel like you had more going on your head. So don't be afraid to experiment with stuff like that, because that also can be quite fun and just make you not wear your hair the same every day because you're scared to do anything different with it, or you feel that's the only way it looks half decent.
Yeah, absolutely.
Has anyone got any more? Did you want to say anything?
Maybe just sort of as a closing kind of thing for you guys, that, there's just so much we don't understand with female hair loss. It is really, really complicated. Like you can spend so much money and so much time to find your answer.
Yeah.
And some women don't find an answer.
Yeah.
There's an interesting, all women within you have a male phenotype. So if you give a woman, like trans men who get testosterone, turn into a man with male hair.
Yeah.
So balding in varying degrees. And there's stuff like that we have just no understanding of.
Yet.
So
you're always learning, right?
I think we're learning. But seeing the bloods, seeing the right person early on, and not just going down to Holland Barrett and back trying different things.
Yeah.
It's so important.
Yeah. So hopefully we've given you some steps that you can take if it's an issue. You can follow Alexis at Dr. Alexis Grant.
Yes.
Is that right?
Yeah,
DR.
that's right.
You can follow me, Jo L. Jones. I do a lot on Instagram because, as if we're doing TikTok at our age, I do try. And we do a lot, and we talk a lot. Alexis particularly talks a lot about more scientific approaches to skincare. Mine's usually me crying about my hair falling out. But, you're not on your own. 1 in 3, or if you're here for someone else, they are not on their own. And that's a really important thing to remember. 1 in 3 women experience hair loss. It is, yes, it's debilitating. Yes, it comes with a lot of upset and shame and fear, but you're not on your own. And when you know that, it sort of gives you a bit more strength and a bit more courage. So good luck, and I hope this was helpful. And thank you, Alexis.
Thank you.
Thank you for bringing some sense to what I was doing.
Great to see you.
Outside.